Hello, and welcome. Today we're going to delve into the world of trachoma, a preventable yet devastating eye disease that affects millions across the globe. Join us as we explore its causes, symptoms, treatment, and most importantly, how we can work towards its eradication. Trachoma is caused by a bacterium called Chlamydia trachomatis. This isn't the same chlamydia that causes sexually transmitted infections, though. These are different strains. The bacteria spreads primarily through direct contact with eye or nose discharge from an infected person. It can also spread through contact with contaminated fomites, which are objects like towels, bedding, and clothing. Flies can also act as vectors, carrying the bacteria from person to person. Overcrowding and poor sanitation are major contributing factors to the spread of trachoma. Once Chlamydia trachomatis infects the eye, it triggers a chronic inflammatory response, primarily affecting the conjunctiva, which is the membrane lining the inner surface of the eyelids and the outer surface of the eyeball. This inflammation initially presents as follicular conjunctivitis, characterized by small bumps on the conjunctiva. With repeated infections, this chronic inflammation leads to scarring. The scarring of the inner eyelid causes it to turn inward, a condition known as entropion. The eyelashes then rub against the cornea, the clear front part of the eye. This painful condition is called trichiasis. Constant rubbing of the eyelashes on the cornea causes corneal ulceration, scarring, and eventually irreversible blindness. Trachoma is a leading cause of preventable blindness worldwide. It's most prevalent in impoverished communities in developing countries, particularly in Africa, Asia, Central and South America, and Australia. Regions with limited access to clean water, sanitation, and healthcare are at highest risk. Children are especially vulnerable to infection, and women are 2 to 4 times more likely to develop blindness from trachoma than men. This disparity is likely due to closer contact with children, who often harbor the infection. The symptoms of trachoma vary depending on the stage of the infection. Early symptoms include mild itching and irritation of the eyes, accompanied by discharge. The eyes may appear red and watery. As the infection progresses, light sensitivity, blurred vision, and eye pain can develop. In the late stages, entropion and trichiasis become apparent, causing significant discomfort and further damage to the cornea. Untreated, this leads to permanent visual impairment and ultimately blindness. Diagnosing trachoma typically involves a clinical examination of the eyes. A trained healthcare professional will look for signs of follicular inflammation on the conjunctiva, as well as evidence of scarring, entropion, and trichiasis. In some cases, laboratory tests, such as conjunctival scrapings, may be used to confirm the presence of Chlamydia trachomatis. However, these tests are not always readily available in resource-limited settings where the disease is most prevalent, so clinical diagnosis is often the primary method used. While trachoma doesn't have distinct types in the way some diseases do, the World Health Organization (WHO) has developed a simplified grading system to assess the severity of the disease. This system is helpful in determining the appropriate course of treatment and monitoring disease progression. The grades include TFS, trachomatis inflammation follicular, TIA trachomatis inflammation intense, TSS trachomatis scarring, TTA trachomatis triasis, and corneal opacity. The treatment and management of trachoma follows the SAF strategy, an initiative promoted by the World Health Organization. SAF stands for surgery, antibiotics, facial cleanliness, and environmental improvement. Surgery is required to correct entropion and trichiasis, preventing further corneal damage. Azithromycin is the antibiotic of choice, usually given in a single oral dose to individuals and mass drug administration in affected communities. Promoting facial cleanliness with water and soap helps to reduce the spread of infection. Finally, improving environmental hygiene, including access to clean water and sanitation, is crucial for long-term control of trachoma. Prevention is key to eliminating trachoma. Improving access to clean water and sanitation is paramount. Promoting hand washing and facial hygiene education, especially among children, can significantly reduce the spread of the bacteria. Mass drug administration with azithromycin in endemic areas is an effective strategy for reducing the burden of infection. Controlling fly populations can also help to prevent transmission. The prognosis for trachoma depends on the stage of the disease at diagnosis and the availability of treatment. Early diagnosis and treatment with antibiotics can prevent progression to more severe stages. Surgical correction of entropion and trichiasis can alleviate discomfort and prevent further corneal damage. However, corneal scarring is often irreversible, leading to permanent visual impairment. Recent research focuses on developing more effective diagnostic tools, improving access to surgery in remote areas, and exploring new antibiotic regimens. The ultimate goal is the global elimination of trachoma as a public health problem, and with continued effort, we can achieve this goal.